When a parent decides to vaccinate their child, the first round usually begins shortly after birth.
And in this week's Medical Moment, we look at the best ways to properly vaccinate.
Back in the day, children were affected with so many illnesses such as polio and everything else, and now we don't see that as much of it because it has been eliminated because of safe vaccines.
Dr. Abhi Singh of Spectrum Health says vaccinations are the easiest way to avoid many potentially deadly infectious diseases.
So hepatitis B is a common one that we give to kids. There's a polio vaccine. We do measles, mumps, and rubella. Varicella vaccine, which is for chicken pox. We have a DTaP vaccine, which is for diphtheria, tetanus, and whooping cough.
And he says the sooner you start your child on their vaccination regimen, the better.
Data usually shows that when kids are vaccinated early, they form more immunity versus when they get older. Usually we like to start at birth. Usually they get their first dose of hepatitis B when they're born. And then there's a schedule that we sort of follow at 2, 4, 6 months. The CDC website actually has a catch-up schedule that we offer to parents who have not, for some reason, not been able to get to the physician to get vaccinated properly.
He adds, even if you're on the fence of whether to vaccinate, it's wise to remember how your decision may affect others.
When large groups of people are in one area, it's very easy for a disease to spread. Measles, for example, can spread if someone with measles coughs in a room and they're in the room, that room is infected for 3 hours, so anyone who walks in can easily get infected. So schools like their children to be vaccinated before they come in.
He adds adults need to stay up to date with their tetanus, whooping cough vaccines, shingles, pneumonia, and flu vaccinations as you age. But it's the children who are most vulnerable without vaccinations.
Recently there was an outbreak of measles in Disneyland, and then now there have been reports of an uptick in mumps. As the anti-vaxxers population grows, the number of the diseases will come back again. So the biggest thing is to make sure that we're vaccinating children.
And for more information on vaccinations, you can go to the website or call the phone number right there on your screen.